with roll call. Pamela Gatz,
Here.
Devin Peacock,
Yeah, close.
Yes.
Here.
Okay. Here. Teresa Gulas,
Here.
Robin Lawrenson, right?
Here.
And I'm glad you could join us
Thank
now.
you.
You know, I'm glad she's a newest member of our
you.
board. And Dennis Highbury is here as well. We also have his staff, Krista Waller.
Here.
Trista Gorth. Trista? Growth. I'm sorry. Growth. And Kelly Burke.
Here.
And that covers everybody. So with that, we'll go into public comments, and we have no public here today, so we will go through that and go on the next one. Item number 3, approval of minutes from the February 10th, 2025 meeting. Do we
Make a
have
motion
a
to approve.
motion?
Yeah, I'll make a motion to approve.
Okay.
A second.
And a second? Any discussion? Well then, Terry, you must have done a fine job chairing that meeting that last week. I was not around last time.
Was there any?
Thank you very much for
Was there any
that.
follow-up on that? Are you going to talk about that later?
Yeah, Trista has that incorporated in her environmental health update.
Okay, all in favor of the minutes, say aye.
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 Any opposed? Motion passes. Okay. Consideration number 4, consideration of possible action on the affiliation agreement between UW Green Bay and the Health Department.
Yes, so this is a standard agreement that the Board of Regents with UW Green Bay has with the Health Department to host students for their rotations. And so this is an ongoing agreement. We've had this ever since before I was here. And so it's just expiring, and we need a motion or your consideration for a motion to approve the agreement so we can continue to host students. And then in the motion, I would have to have this go to City Council for approval.
I'll make a motion to approve.
Okay, do I hear a second?
A second.
Second, okay. Any discussion? I'm going to just ask a question. We've had students all the time? Okay. And how long do they stay here?
It depends on the program. Sometimes it's 3 months, sometimes it's shorter, sometimes it's just hours. It just depends on the program. The graduate students typically are here longer, and we can delegate a more significant project to them with our oversight. But undergraduate students usually are less.
I do have a question.
Yeah.
How many do we host?
In a year?
Yes.
Oh, that varies. Because we also have Bellin College, we have UW Green Bay, and then we have graduates. So this last year, let me think, we had 2 graduate students this last year. We had Zach, and then Allie, most recently with Michigan State University. UW Green Bay, I'm trying to remember. No, we didn't have a student with UW Green Bay since I've been here. We actually had one with, I'm trying to think of the university. She did the rabies education program. Abby was her name. Where was she from? Staff, do you remember? Kelly or Trista, do you remember? If Sarah was on, she would have the university. I'll get that to you.
okay.
But I think we've had 4 that I can think of off the top of my head, but not one since I've been here from UW Green Bay. But I know historically in my first time around, we had lots of UW Green Bay students.
That's fine. I was just curious. Thank
Yeah.
you.
I think she was out of state, like Arizona State University or
Yeah.
something.
Yeah. It was University in Arizona. I can't remember the name of it.
Oh.
That's called a long-term relationship, I guess. Okay. Any other discussion?
ASU, U of A.
U of A, yes. Hearing none, all in favor of the contract, say aye.
Aye.
Any opposed? Motion passes. Going on to the next item, number 5, I'm sorry. Yeah, that's right. Consideration and possible action on the Bellin Emplify EpicCare Link Access Agreement.
So we continue, As you recall, you have recommended approval of previous EpicCare access links to other healthcare organizations. We have to negotiate each individual health system agreement. So this is one of our last ones locally. And because of the merger between Bellin and Amplify, or to Amplify, I should say.
You say that a couple times fast.
We need to have both contracts because we don't know how long it will take for the EHR access to merge. They say right now it will be the end of July 26th. So we just want to have both contracts so that we're covered. And again, we only access information as it relates to mandated, reportable, communicable disease. So we can finish our public health follow-up without having to ask manually for medical records through the fax machine.
Okay.
And we have contracts with other agencies as well, Gunderson, HSHS,
Yep.
Aurora. So this is the same thing, except it's just with another healthcare facility.
Correct.
Okay. Any discussion? Hearing none, all in favor, say aye.
Aye.
Opposed? Motion passes.
And that one I will have to bring
We
forward.
didn't do a
to-
motion,
We
did
have
we?
to do a motion.
I'll make a
I'll make-
motion to approve, though.
Okay, I'll second.
Okay. Did I miss motion?
And we're
Okay.
good.
Okay.
1 month.
That's okay.
Okay. Number 6, consideration and possible action on the St. Norbert College Use of Facilities Agreement.
Yes, so every year we host programming at St. Norbert College, it seems, since I've been back anyway. And this time, the contract, again, was sent over, and I need to get a certificate of insurance. So for signatory authority, placing this on, the Board of Health, I was informed since the agenda was posted that I don't need to bring this forward to City Council because in the resolution, last year when I put it forward, it said any subsequent contracts can be signed. So for this purpose, if you would like to consider and approve, just knowing that we're doing additional programming at St. Norbert College, we're doing a senior ball, which we're having college students have a social interaction with our older adult population, and we're going to
cute.
have them do dance together, and we're hoping that this will preclude some intergenerational programming between the college students and our older adult population to include maybe, helping them set up a Facebook account or helping them navigate email. So this is hopefully the foundation to future programming. So
Great. Yeah, I'll make a motion to approve.
Okay, do I hear a second?
Robin.
Okay, any discussion? I have a question, Krista. You
Yeah.
said you'd done this before in the past?
yeah, there was an agreement with St. Norbert College
Okay.
for Dr. Carol Brees last year.
Okay, but you've had
Oh,
activities at St. Norbert College. How have they been attended?
we had over 100 people attend the Science of Social Connection with Dr. Carol Brees. And that was last year in September, I believe. It was last fall. So well attended, and it was students, faculty, staff, as well as general community members. So it was great to have all those people, and it was highlighted in our annual report. You probably looked at that, so.
Oh, fantastic, 100 people, it's quite a few people to
Yeah.
have for that event
Right.
as well, so.
In the evening, people's schedules are so busy.
Any other discussion?
Sounds great.
All in favor, say aye.
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 Any opposed? Motion passes, okay. And we're up to number 7 now.
Yes.
Consideration and possible action on the intergovernmental agreement between the City of De Pere and Brown County regarding local health department inspection of the Brown County Fairgrounds.
Yes. So as you probably read in the memo, the City of De Pere has a lease with Brown County for a portion of the fairgrounds. And after talking with Trista, after talking with Brown County Health Department Health Officer Anna Destry, or Anna Nick, sorry, she got married. We needed to look at the opportunity to delegate the oversight and management and control of programming that goes along with that, i.e. special events, because their parks department oversees, because of that lease signed in November of 23, oversees all of the special events. So it just makes sense that, the inspection follows suit for any special events, and that would be food truck inspections, or Trista calls them temporary restaurants, yes. And so when I talked to Anna about it, she agreed and supported that, and also contacted DATCAP, so Department of Ag, Trade, and Consumer Protection, because we're an agent of that state agency, to make sure that they don't, have any concerns, and which Jim had.
Kaplanik.
Thank you. I always say Kazmerzak. Kaplanik said he didn't have any concerns. So we're really looking at being able to align the inspections with Brown County. And actually, after doing some investigation, because, we know that there's a state fair in Wisconsin, and it happens in the city of West Dallas, called down to West Dallas, and I said, hey, do you all do the inspections at the state fair? And they said, no, the state does the inspections at the state fair, on the state fairgrounds in the city of West Dallas. And I'm like, well, it's kind of the same thing, right? That we're kind of looking at doing here. And it really is going to help Trista's workload. She is a one-person show here, and the events that have happened there and will continue to happen will definitely be a strain on our one-person show resources. So just offer that up for discussion, and I can answer any questions. We also have Trista here.
Let's start with a motion first, a motion to, discuss this. Can I have a second on this?
I'll second.
Okay, let's have discussion then. Any discussion?
Have you talked to Brown County about it at all?
Yeah.
Yeah.
Are they receptive?
Yeah.
Awesome.
Yep.
That's great.
And the only thing right now in the process, because Eric Erdman drafted this agreement, so he's been in communication with Brown County Corporation Council, including Anna Nick, in those conversations. And so there is some legal, what do you call that? Legal negotiation that's occurring. And Eric is navigating those conversations, but the concept itself, we wanted to be sure that you had it in front of you for consideration.
I think that's great.
Trista, how many facilities and how many weekends does that involve? Has it involved in the past?
The last 6 years since I've been here, there's just been a few each year. And then the Brown County Fair, which is the one that takes the most time, is done during the week. And then starting last fall, there's a new Hmong sporting event festival going on that is an all weekend deal. And I just found out they're doing it again this June. So it sounds like it's going to start back up again.
Did you say a Hmong sporting event?
Yes.
Oh, cool. What do they do for that?
Usually it's soccer, maybe volleyball.
Nice.
I'm not real sure. I don't really get out of the food area much.
They used to have Hmong annual conference. Actually, it was an annual meeting. Everybody came to Brown County years ago, and there were probably 50 plus stands and thousands of people there.
Wow.
And nobody understood, and English was definitely a problem trying to convey how to cook and how to prepare and how to refrigerate and everything else like that.
And I think, the event itself is one thing, that direct time at the fairgrounds, and it's also all of the coordination and the prep time that leads up to the event. That's very resource heavy, especially for one person.
Now, the fairgrounds is city to peer property, I guess, right?
A portion
Part of
of
it.
it.
Portion of it is,
Yep.
okay. And we're just asking Brown County to take over the whole thing, and they were willing to do that as well.
Yep.
Great.
Good. They're willing.
What kind of, is there going to be a fiscal impact on that to us?
Yeah.
To the city to peer?
Yeah, it's not significant for the time invested. I think we brought in approximately, it was like right around 2,000. And with that, the increase in tourist rooming houses and short-term rentals definitely way overcompensated for that revenue. So there is a potential campground license that would not be collected at the city of De Pere, as well as any of the
Temporary restaurant
yes,
permits.
correct. And with the quantity to include the Hmong Festival and to include the Brown County Fair, calculated to approximately $2,000. So if I divided Trista's billable rate into that amount of money, I think that equates to approximately 30-some hours. And I know that with the prep time, Trista spends way more than that. And again, like the memo said, this agreement will allow the health department to focus time and energy on City of De Pere hosted events, and also looking at those potentially non-compliant short-term rentals. To free up her time to be able to do things like that. Again, which is another revenue source.
And he also said that Brown County sanitarians are very agreeable to do this and probably
The health
go there in
officer
mass
is.
as well. The health officer is.
At this point in time, the health officer is.
Okay.
And DATCAP department is agreeable to it. It's just a matter of the legal negotiation. So Anna has always been, ever since I've come back, been very supportive of, helping out. And actually, even in 2024, Trista, you can maybe speak to this, she had some of her staff go to the fair and go to the Hmong Festival too, to assist Trista, because the volume and the work was so intense. So she's been so helpful.
I know. My staff used to do the same thing as well when I worked for the state, and it was very, very busy and a lot of places and very time consuming. So for one person, I can see
Yeah.
why it's nice to
Just-
have somebody else do it, I guess.
A little
so.
rough.
Yeah, it is rough. Yeah.
So will they do just those 2 events, or will they also do the other events? Because there are other events.
Yeah, any
Go on.
event that has food vendors that is hosted at the fairgrounds. So it's not just the 2 specific events, it's any event. And it's interesting because the lease agreement does delegate the oversight, management, and control of the entire fairgrounds property, as well as the events conducted thereon. I took that right from the agreement. But yes, to your question, Pam, it would include any event that Brown County hosts or plans to host at that location.
Because I know we do rent it out as well, correct? So who does that then? Brown County?
We rent it out. What do you mean? Oh, register special events? Is that what you mean?
Yeah, sometimes don't we rent out the fairgrounds as part of De Pere to other organizations, or no?
That, not sure about that. Wouldn't go through our department. It would be through Parks probably.
Yeah, but I think, and I don't know, I could circle back
Maybe
with Marty.
Parks, yeah.
But I do believe that was the intent of this lease agreement.
Okay.
That it would be managed by Brown
Okay.
County. And this was an agreement that the city entirely approved, not just the health department. It was like
Okay.
an agreement with the city. But I can circle back to Marty on that just to confirm. But I am pretty sure that this lease agreement that was passed in November of '23 with the city of De Pere and Brown County Parks was that it was delegating all of what you had just asked.
Okay. Yeah, I'm pretty sure it was Parks Department. Do you remember?
And in terms of the health department's role in that, it's really just for temporary restaurants and campground licenses. Those are the only things that we would be in, the Pere Health Department would be involved in, and giving up that portion to Brown County Health Department.
Yeah,
Right?
and, yeah, sorry, I was gonna clarify too. So there's one campground license that Brown County holds because of the the camping through RV
Okay,
trailers that's allowed there. So that will go to Brown County, and I think that that license fee is something like $200 or $300 annually. And then with the temp events that occur, part of a change with licensing for those events took place a few years ago, and all agent health departments are required to accept other agencies, either mobile or temporary license. And so what that means is I can get operators from anywhere in the state of Wisconsin that comes to our location, and the agency that issued that license is collecting the larger fee. I can only charge an inspection fee. And so if there's non-compliances going on, I'm spending all this extra time doing enforcement, and we only can charge that inspection fee. So it's an even greater amount of work for us and less money.
Yeah, and the campground license fee I have written down is $301, so you're right on.
well, having one person being responsible for all the places that come up there, I think it's a great opportunity to not share the load, but relegate the load to Brown County, which has more staff and probably would be able to do it a lot quicker than what Trista would, and have her do things in the pier,
Yeah.
excluding the fairgrounds.
Correct.
So,
Yep.
Because the city of De Pere itself has a lot of hosted events that she could refocus her time on.
Yep.
Is it 2,000 to 3,000 per event or for the whole contract?
Oh, it would depend on how many events that they host in subsequent years. But I looked back at 2024 and what we brought in for revenue, and that's what I came up with.
Okay.
and that's $3,000 total for the year.
Yep,
Okay.
yep, for 2024.
Do you also work the Celebrate to Pier?
Depending on what vendors are there, yes. If they are a nonprofit, we don't do inspections. We could. I say we, like there's more than one of me.
The department, yeah.
Yeah. So nonprofits do not get an inspection unless they exceed their 3 days per year. And I just got this Celebrate list, and there's like one or two like actual for-profit vendors that are going.
Oh,
So I
wow.
haven't had to go in the last few years.
Okay.
Yeah. But there's farmers market, food truck rally, beer gardens, and there's a couple other businesses that have food trucks on site occasionally for music or something like that. So I'm able to spend my time focusing on those versus spending an excessive amount of time verifying licenses for those other larger events.
Do you also do the bike race that's coming up?
Yes, if there's food vendors, I believe there will be.
You haven't seen that
Thank
list
you.
yet. Yeah.
Because it's 2 days now?
2 days, one on the east and one on the west.
Okay.
Sunday and Monday.
Yeah.
Yeah, it's exciting.
Yeah.
Got more work for you.
With the beer gardens being every Tuesday, is it a lot of extra work for you?
So the way that I work those inspections is the same as what our other health departments do in our region, which is if a food truck comes in and they can show a recent inspection report that shows no violations, then I will skip them. And I did that primarily for time saving. But I could still choose to inspect them if I wanted to. but there's a lot of those food trucks that are, you see the same ones all the time. So if I see them at the farmer's market, I'm not going to then do another inspection at another event in De Pere. So, and we kind of know, you see the same ones over and over, so you kind of know who to spend your time on and who not to.
It's good.
Any other discussion or questions?
No, not for me. Thank you.
Okay. Hearing none, all in favor of contracting with Brown County Health Department to do inspections of the fairgrounds, say aye.
Aye.
Any opposed? Motion passes. Trista, you just have yourself a couple weekends that are free, I guess, now.
And then I'll just mention that I'll wait for guidance on Eric on when to place it on the city council meeting agenda, if we need to wait for that last negotiation or if I should put it on. So
Okay. Thank you, Crystal. Item number 8, environmental health report. And I take it that's probably why you're here, Trista, as well, to talk about information, bed
Trista
bugs and everything
offered
else
to
like
come
that.
today. That was so nice.
Mhm.
Yeah, it was a full moon today or tonight.
I thought it was Saturday, no?
It is definitely today.
It is definitely
Okay,
today.
today.
One of those days.
Yeah.
Well, I'll start out, and then if you want to jump in at any point. So at the request of the Board of Health, you saw in the memo, Trista had written up a report on the bed bug situation over at the apartment building on the west side. So to date, we have not received any additional complaints filed with the health department for this concern. And you see in the memo that there was also a concern about elder abuse is how it was mentioned. And the Brown County Adult Protective Services and the health department had communicated our actions, what we're doing, and they have the information to do their appropriate follow-up. And it really is, any elder abuse per se would be out of the scope for local public health. There are county agencies that take care of those complaints. And so we let them do what they do best and provided information and let them determine. So at this time, we have considered the case closed because, again, we haven't had any calls since February. Now, Trista is in communication with the apartment building, and Trista, you can give more detail, but I do know that they continue to actively treat because it's a process, and it's not just a one treatment and it's gone. It's a treatment and then 30 days and then another treatment and then 30 days. And so the apartment building is doing what they need to do to take care of the situation. When the health department gets involved, typically is when there's no action by the responsible party, especially in a tenant-landlord situation. So then the health department would write orders to direct, this is what needs to be done by this time frame. If it's not done, then forfeiture provisions and all the stuff that goes along with that, and working with the police department. But to this point in time, the apartment building manager in the management system, they're continuing to do the treatment of the situation. So not to say that we won't get more complaints, and if we do, then we will go out there, continue to make calls, but the apartment building is responding. Trista, I don't know if I missed anything. If you
Pretty
have.
much sums it up. I mean, they seem to be very responsive. And unlike some other apartment buildings, depending on how the lease is written, those tenants might be responsible for paying for that treatment. And at that building, they're not being charged for it. So I think that's a huge benefit for them. Maybe they don't realize it, but they are actively addressing it. So I'm not real sure what more they can do. And hopefully it just corrects itself eventually.
Yeah. And I think with persistence, and correct me if I'm wrong, persistence on the apartment building with their treatment in 30 days in treatment in 30 days. Like, I think that if that continues, eventually it will be eradicated, but it is a process and it's not something you can take a pill and then they're gone. And I know that that's frustrating for people.
Would you routinely reinspect those properties at all, or?
If we
It's
were
always closed, but,
if we were invited in,
okay.
you know, if Trista got a call and, you know, one of the tenants were like, could you please come in and see if you confirm any live bed bugs, we would go in.
Yeah, I think that would probably be a rarity for us to do that because the pest control companies that are doing those treatments, they would need to verify after a treatment whether or not it was effective. And additionally, in the past, they were working with John Sandberg from Sandberg Canine Services, where he uses his dog Chester to search for those bed bugs. And I'm not sure if they are continuing to work with him. Just because I haven't received an update yet. But I would be more comfortable trusting the dog versus myself. Because if you're going to do a really effective bed bug inspection, you have to like take mattresses apart and our beds apart and like kind of make a big mess in order to find it. And you may not. So I'd rely on pest control and then the dog before myself.
Yeah. And outside of this situation, we've gotten images of bed bugs where people are like, is this a bed bug? Can you identify this as a bed bug? And is it alive or dead? I mean, that's all something that, community members can utilize the health department to assist with. But yeah, Chester the dog and any other dog trained to do that, I mean, that's what they do.
Far superior
That's their
than
job.
human is to look for bed bugs.
Yep.
Have we had any communication, or has a complainant communicated back with you during this last period of time?
No,
Okay,
no calls, no emails. So
maybe no news is good news then, or no information or no communication is okay then, okay.
yeah.
And you say right now the case, as far as you're concerned, is closed because of the preventative action that's being taken place by the apartment, and they are continually working on that as well.
Correct.
Okay, good. I'm glad I missed that meeting last time.
Yeah.
I understand it was quite an interesting discussion for about half an hour, yes.
And no, just to make a point, at the time this memo was drafted, that was the information we had. Trista called the apartment prior to this meeting just today, and they said that they're continuing to treat.
Okay.
So she wanted to get hot off the press information for you all.
Thanks, Trista.
Well, we have you here, Trista. Can you talk a little bit about the short-term rentals, 21 to 57?
She did it.
Yeah.
I survived. Yeah. It was, it wasn't as busy as I thought it would be, but it was still a lot of work because we have that extra step with people having to apply through the city to get approved. So planning, zoning, building inspection, police, all approve it before it comes my way. So I found out in the beginning there was a lot of additional education that needed to take place because people weren't understanding the process. And then when they did apply with our health license, they were leaving information blank, and so then there was more follow-up for that, and some people ghosted me. And then there were probably, I think I had at one point about 15 that were showing up as advertising and or renting, and they were not licensed. So we sent a letter of notice of violation, and the intent was just to get them to call back. And it was effective, actually. I didn't really get any negative feedback from anybody about like, why do I need to do this? I think people understood the importance of it. But yeah, it was a lot of again, a lot of back work going on in the office. And I still have 4 or 5 that are kind of just hanging out, waiting, pending, not sure where that's going. So I'm going to be continually, I took a little, Peter from planning, he and I took a little break from our meetings. So we're going to reconvene closer to the end of the month to mark on the city's website which ones are actually licensed and I guess current on their license. But then in July, we'll be able to tell who's going to renew or not. That'll be interesting. I'd heard from a lot of people that they did not get renters. And I think part of it was because they were charging like $5,000 a night. My opinion.
Okay.
I was just going to ask how many actually rented, because I heard a lot in Green Bay did not rent, even some of the hotels.
Yeah, there's no way to know. I'd heard from probably 4 or 5 different people just through conversation that they said none of their properties had rented. I had thought about sending out a little survey when we send out our renewals, our renewal notices later this week of just asking, but I don't know if that will really benefit from.
Well, that's probably just a one-shot thing anyway for the 30-something that thought there was an opportunity, and if they could rent it, they at least would comply with the city De Pere ordinances for
Right.
tourist rooming homes. So
Was that how many we had? 37? 57?
Yep.
Yeah, and I think now we're at 60, something like that.
And how much did they have to pay for licensing, et cetera? Do you know?
Yes, so there's, with getting the initial license, there's 2 fees. One is the pre-inspection, which is where I go on site and actually verify that they are complying with the code. And that's the one-time fee of $159. I'm looking at Kelly because she just.
Yeah, it was 280 total, but then with the fee increase,
Yeah.
it went up after April 1st.
Yep. And then the annual license fee. So the 2 combined is now $294. But then when they renew, the annual license fee is, I think, $135.
And they had to pay $100 to
Oh, right.
City Hall
Developmental
also.
services.
So if they didn't rent, they may not be renewing, possibly?
Correct. Yep.
Yeah.
So we'll know come mid-July who's renewing and not. So that'll be interesting.
Yeah.
It seemed like a lot from what I heard, if they were in the area of Lambeau, they may be rented, but like north, south, east, west, they didn't really as much rent, but I don't know. I know there were a lot still for rent at the time of the draft, so. And I did hear a lot of them were overcharging and then brought their price down the next night. It was the same with parking too, I think I heard.
Yeah.
well, it was an opportunity that we had here in Brown County for a major event. And
Yeah. Nobody
they
really
wanted to
knew.
capitalize on it. They could have, I guess, and they did by getting a license. But if they were booked or not, that was not our problem,
Right. Yep.
So, okay. Well, thank you, Trista. At least we licensed the 57 places or 60 places we have in De Pere, and that will probably go down next licensing period then.
Yeah.
So thank you for doing that.
Yeah.
The last item you had on your thing, on your notes, was a new code enforcement specialist. Can you discuss that a little bit? That's a new position here in De Pere?
It is a new position. It's under development services. So he works alongside planning, zoning, building inspectors, and is doing exactly that, code enforcement. So he's been very busy. One of the things that he kind of has taken over for our department are complaints of dog poop. Those are
Fantastic, yeah.
yeah. It happens, so he's taking care of those. But one of his other job responsibilities in his job description is to assist with weights and measures. So I'm going to slowly work him into it. so that we can maybe split it, the responsibility, which will, again, free up my time so I have other things I can focus on.
Now, would funding also partially go to him as well for those places that he does weight and measures activities with?
Yeah, it's a city revenue line item, and it's in the general budget, because revenue isn't split in between departments and allocated that way. So, so we haven't.
So it isn't part of
discussed that.
of our budget here then? It's
Yeah, the revenue line item is part of an
Okay.
overall city revenue package. So they haven't, to my knowledge in the history, split up the revenue. I mean, it definitely has a line item that says weights and measures program. And that we definitely have a line item that says agent program, so any license fees, but it's in the general city budget as a revenue.
Okay. So
Knowing.
whoever does the work, it's still part of the city budget either way.
Yep, yep. And even to have backup for weights and measures, like God forbid, if Trista goes out on family medical leave or something, you know, it's a responsibility that municipalities have to do weights and measures. And so having that cross training and that backup is so important. So he's great.
And how long are you going to be mentoring this new code enforcement person?
That is a good question. I think, until it's kind of to smooth things over, I guess, after you get onboarded. So I'm not real sure. I've not done this before, but I check in with him periodically and ask how things are going and see if he needs any assistance or guidance on anything. So
Okay.
Because it's not
eventually he'll decide he doesn't want me anymore.
He'll let you know then, I guess, right?
Yeah.
Okay.
It's a nice program that HR has set up. 'Cause it's not just for job-related things. It's also just like, hey, how does Friday afternoon work? Did we really get off at 11:30? It's general city questions, or questions about benefits, or how does this work for you? So it's a really nice mentorship thing that program that HR has set up.
Any other questions of Krista or Trista on the environmental health program? Trista, thank you very much for taking the time to come here. And if there's a full moon, let us know, okay?
There is.
I feel it already.
Okay. Going on. Review and approval of the 2025 policies and procedures.
Yes. So I did not bring the big binder of policies and procedures. I just know that every year we review all of the policies and procedures. We make revisions as necessary. And we either sunset policies and or create new ones based on, what's happened over the last year. So the only new policy in this year's docket is the isolation and quarantine policy, which outlines the legal authority and process. And that legal authority has been written into state statute for decades. And it really started with tuberculosis, but then applies to other communicable diseases. So this replaced a more specific policy regarding deputizing quarantine guards. And again, that really stemmed historically from tuberculosis. And this includes that information, but we don't have a standalone policy anymore that talks about deputizing quarantine guards. So also that health department pandemic plan that was incorporated in our policies and procedures is now relocated, and it's just logistics. It's relocated outside of our policies and procedures into the public health emergency plan, which we also have available electronically, and I don't know if it's even printed anymore, but that was revised with Debbie and staff in response to COVID. So what were the lessons learned and what do we have to change going forward. So the animal bite policy was significantly revised to mirror best practice standards, especially relating to documenting all of the bite reports that come in from police, because they issue the orders for quarantine, but now are embedded in our electronic disease reporting system, so that if we have repeat offenders, it's easier to search, for us to determine if a dog is dangerous, because as you all very well know, multiple bites necessitates the dangerous dog order, and then if they appeal it, they come here in front of you all to make the final determination. So that system, that electronic system, is better for us than a spreadsheet, and that's what we were using. So it really incorporated those bites into a statewide disease, electronic disease reporting system. And then finally, the agent program policies and procedures were revised to reflect current operations. How we use conditional licenses, and how we do stepped enforcement for non-compliance. So if there was a restaurant or any food establishment that wasn't following, Trista's orders per se, then there's stepped enforcement, and it follows our policy accordingly. So those were a summary of the revisions. If anyone wants to see the specific policies and procedures, I'd be happy to forward you a copy. And this is something we do annually. I see Dr. Shandell is on here. I'll also say that our standing orders that are accompanying the policies and procedures all have auto renewal unless something significantly changes. So those are like for our immunization administration policies. If we ever feel like we need to do TB skin testing, again, we don't currently offer that service, but that standing order is in there auto renewing, and Dr. Shandell has already signed off last year. So
Okay. And you have a motion to accept the policies and procedures for 2025.
I'm so moved.
So moved. I hear a second.
A second.
Okay. Any discussion? I do have one question, Crystal. I think when I look at the dates over here, you have a lot of time being spent doing this, and is this the staff thing that you sit back and all the staff sit back and look at the policies and?
we all take a portion of it.
Okay.
Yeah. So I take a load of them. Of course, Trista takes, the agent program, environmental ones. Kelly takes some of the administrative policies. Sarah and Danielle, nursing associated ones. So we all have our hand in it.
Okay. And Dr. Shandell then looks at the medical ones, and she signs off on those as well, and makes
Actually,
changes.
Yeah, I mean, really, they're auto renewing and they're standard, so
Okay.
it's not a requirement to have her review them according to how they're written currently. But Dr. Shandell, if there's at any point that you would like to re-sign, it's just not required at this time the way we have it set up.
Okay. Any other discussion? Hearing none, all in favor of accepting the 2025 policies and procedures, say aye.
Aye.
Any opposed? Motion passes, policies have been passed, okay. Next one is the annual report.
Yes.
The
so
majority of what we had in paper is the annual report, looks like, okay.
I just wanted to say a special thank you to Sarah Lawrenson. She's not here tonight, but just publicly thank her for her work on putting this together, as well as Kelly with the formatting and, the consistency and, we call it Canva is the program that we use for our annual report. And Kelly is a Canva pro. So just want to thank both of them. We were excited to put this together. I think that the most important thing that's changed, and this even was done last year, was that this annual report aligns with the FAB, the Public Health Accrediting Board standards, with the foundational public health areas and services. And we felt strongly that it was important to align with that. Again, at this point in time, we are not going forward with accreditation. It's very costly and time consuming, but we like to take those best practices and those standards and incorporate that in our operations regardless. So that's something we strive to do. So that formatting stays the same as last year, but it is important to note that we are aligning with the FAB accreditation standards for that.
Do you look toward getting accredited in the future?
Yeah, that's a really good question. It does cost money, and the accreditation itself, rightfully so, needs to be renewed regularly. And so there is an option for what they call pathways, which we were waiting to see what our determination was with our level up of our review with the health department, and then consider maybe pathways, which is not accreditation, but really gives you recognition for following best practices. And that is something we might consider. But at this time, with funding and with grant awards in flux,
Uncertainty.
we're not quite ready to do the
If I
full
recall, I think it
accreditation.
was very expensive to
Yeah.
be certified or be accredited. I mean,
Yeah.
it's thousands of dollars, isn't it?
Correct. Yep.
And the question is there better use of that money within the department than it is to give it to an outside agency and get a piece of paper saying you're accredited?
Yeah.
So,
So more to come on that. We may consider pathways, but not sure full accreditation is something at this time.
anybody have a chance to look at the annual report?
Skimmed it.
Yeah,
Same.
same.
We can have a motion to look at the annual report and accept it. And do I hear a second?
I'll second.
Any discussion? I had to make a comment to Crystal, just point this out that this is last year's picture, this one in the center of all the group. You know, it's the same, except with
Different
Crystal in
person.
the middle. Clothes are the same and everything. I had asked her, how'd they manage that? And I said, don't you ever get new clothes, I guess is what the comment was. And the answer was, go ahead and tell them so
Sure.
they know.
So Debbie
Photoshop.
insisted at her retirement party that she get a picture. Well, of course, everyone wants a picture with her as she exits, but then she insisted that I step in without her and take a picture with the staff. And so I stepped in, the staff did not move. They had the same clothes. It was the same exact day, just a minute apart.
That's funny.
Same location, same
Same
clothes,
location.
just one person different, I guess is what it was.
Correct.
Yes.
I was gonna say Photoshop, but I
That's what I
guess
thought too.
Well, I had
Photoshopp's
asked Crystal,
okay.
now I understand the reason why, I guess now. So next year we should have a different picture in there with
Right.
different clothes, I guess,
We'll
right?
have different ones, yeah.
Okay. Any discussion about the annual report? I think it's a very good report. It's easy
Yes.
to understand. It's written well. Gives
Really
a lot of
nice.
information.
Are you offering to take them shopping? Is that
Yeah. Shopping spree. Going.
sounds
You know,
good? I'm
St.
in.
Vincent de Paul and all these other places have really a good selection at times, you know, so.
Great formatting too. Who did the formatting for the report?
Yeah. it's
That
good.
is Kelly. Kelly takes care of all the standardized formatting. She really makes it look nice.
Yes, she does.
Nice.
Sarah did some of it.
Sarah did,
Yeah.
yep.
Very, very nice.
I just fine tuned.
She's a good fine tuner.
Okay.
Yes.
We've had many years' experience working on this as well, though, so
Yeah.
it's been have
Thanks
it
for all
down
the
to
work.
science, yes.
Yeah, thanks for all the work you put into it, though. It really helps.
Yeah. Thank
Is this
you.
also shared with other health departments as well?
Yeah, it's
Or
on.
upon request?
Yep. And then also posted on our website. It's shared with the Division of Public Health tomorrow, actually. I had to wait until it was approved.
Okay.
But it will be shared tomorrow.
Okay. Any other discussion? Hearing none, all in favor of accepting the 2024 or 2025 annual report? Say aye.
Aye.
Any opposed? Motion passes. Very nice job on this,
Yeah. Very nice.
everybody in the staff, yes.
Trista, Kelly.
Yeah.
Good.
Yeah.
Communicable disease report as of May 2025.
Yep. So our Danielle submitted this summary. She always pulls together the narrative for this. Seems our chlamydia numbers are down, which is good news. We hope that that continues. I will mention that Danielle and Oneida staff and Brown County, we have a STI prevention partnership, and they were all at the draft handing out condoms and information on
Wow.
sexually transmitted infections. And so we hope that those numbers will continue to go down.
That's great.
We're also doing some outreach at our local taverns and getting supplies and information in the hands of their patrons. So they're really working hard on that. It is the most reportable communicable disease, and so really trying to work on that. Respiratory norovirus season, 6 outbreaks, mostly in long-term care facilities and schools. She had mentioned that COVID hospitalizations were down, as well as RSV hospitalizations. Remember, COVID is not a reportable condition except for hospitalizations to local health department. Influenza hospitalizations were up, unfortunately, compared to Q1 in 2024, and you'll see that was by three cases. We did have a carbon monoxide poisoning that's reported, but that was an isolated incident. And it was not at like a public facility. So we did have a latent TB infection. That's what LTBI stands for. Case completed a full course of treatment through the health department. That's where we observed, it's called direct observed therapy, and we observe and administer the antibiotics. And again, that was a 12-week course. And so we don't have at this time, knock on wood somewhere, probable or confirmed pertussis cases. So let's keep that going.
Good.
Yeah.
No measles yet. Yep.
No measles.
That's good.
I don't think we need motion on this, do we?
Just discussion.
Is latent TB always monitored treatment?
Not always.
Oh.
If they get medications through the state, then it is.
Okay.
But they could choose to go through their private insurance.
Board members, do we need a motion on this, or is this just discussion, information only?
It's just discussion.
You don't
I
think so?
believe.
Discussion, yeah.
Yeah, I don't think we need to vote on anything.
Okay. Then let's go on to any other questions about communicable disease. Then it's dashboard results.
Yeah.
Q1 dashboard results.
Yeah. So we started this last year. You all saw the dashboard for Q1. We are, that very first year, we were trying to get a baseline of data to begin to monitor. And so now, we are coming upon our second year in Q1. And it really allows us to look at improvements. What should we change? What should we keep doing? One of the things that came up last year was really Trista's workload. And this is why, we are making some recommendations to, onboard Chris with developmental services to help, offset some of the workload, or work with Brown County Fairgrounds, with Brown County Health Department to see if, we can get some of her volume shifted. Because at this point, I don't think we're ready to ask for another staff person. I think we can make these operational changes to shift some of the workload. So this performance management dashboard really allowed us to take an objective look at that, systems, services, and processes. So we've made some edits to the tracking dashboard, and we'll just continue on and keep this as a quarterly update for you all. I will mention that there was a glitch in our civic clerk, and I did have a director's report as a separate agenda item, but I see that it is not on the agenda. So I did want to just weave in some of the director's report in this program performance management update. Just as we talk about immunization tracking, and that's one of the, like, influenza vaccine uptake is one of our performance measures. We also look at the percent of children that are up to date on their vaccination as part of our dashboard. We, this last quarter, did a outreach mailing to all children in the city of De Pere who have not had any measles vaccines. Just educating them on the current state, and that if they have any questions, contact their provider or the health department. So that was something that we did, also a joint press release talking about the importance of measles vaccine. So again, hopefully affecting our performance dashboard and the uptake of vaccine, not only for measles, but also other recommended vaccines like influenza vaccine. Just on a side note, maternal child health is also on the dashboard. I just wanted to update you all that the maternal child health funding is continuing without interruption at this time. That maternal child health funding has allowed the health department to plan intergenerational programming at St. Norbert College, older adult community, promoting social connectedness. So that funding is really important for programs and services at the health department. And we do have some of that tracked within our dashboard. But at this time, it hasn't been disrupted. Now, I can't say for sure that in the future it won't be, but it does allow us to do some really neat things. Like this year, we're working with our Parks Department to sponsor a bench with some of that funding to really facilitate an environmental change so people can sit together and talk. Funding benches. Also, we send newborn packets out to every new birth family in the city of De Pere, and we want to add to that birth packet of resources and information to include a new onesie that says belonging begins here. And it kind of aligns with the city's branding initiative with that social connectedness. So that funding allows us to do those sorts of things. Of course, the mural that was funded by Maternal Child Health did win a Main Street Award. So definitely De Pere was highlighted with that initiative, that collaborative initiative on that art mural. And Mayor actually mentioned it at the State of De Pere. So that funding allowed us to do that as well. So I think that, my hope is that our maternal child health funding doesn't get disrupted. The only grant update I do have that has been disrupted so far is our immunization grant. And we will be expecting a 50% cut in our immunization grant funds. So all of that, the performance data that we're trying to track for you all, just know it may be impacted by the fact that we are realizing a 50% cut on immunization. Now, that being said, we will still outreach as our budget allows, and we will still, send the letters and do the things, but we will just have to monitor how that will impact our
What's the
outreach.
monetary amount that we're talking about, from what to what?
Yeah, so right now, I do believe that we're getting 7,000. So Kelly will check my
Okay.
recollection
See how
while I
your memory
continue
is,
to
okay.
talk.
$8,939.
8,900.
Okay,
So cut 50%.
50%.
Yeah. So,
That's sad, it really is.
so that is the grant update overall. I will say that at our most recent WALDAB meeting, Teresa was able to click in virtually, and our executive director of WALDAB did give an update, and they are monitoring the current status of public health funding, and then keeping local health departments in the know of what is coming down the pike. And I would be able to communicate it to you all in my director's report. But just know that it is being monitored, but at this time, that is the only grant that has been affected. We
Right.
knew that COVID immunization money grant was ending at the end of June, so the fact that that is ending was not a surprise to us. But I don't know, Terry, if you have any other comments of
Just happen to have my notes.
Oh.
with me. Let's see. No, I don't think so. I think you did a really good job presenting us so positively, so realistically
good.
and positively. Yeah, that's nice. Makes me proud.
Good.
It seemed to me I heard a lot of COVID still being prevalent in the city of Green Bay, at least. So, I mean, I think a lot of it wasn't actually reported, but I do know a lot of people who had it.
And the state does wastewater monitoring for COVID. So even if, people aren't going in for testing or what have you, that is a mechanism to kind of get a pulse on what sort of activity is happening or circulating within not only the city, but also all municipal water that is being tested. And they have a state website that you can see all of that wastewater testing. It's actually a pretty neat mechanism for monitoring what's currently circulating. But yeah, I just wanted to make a note too that our community health assessment and health improvement plan is completed. That's a requirement under state statute and posted on our website. We do that collaboratively with Brown County and our health system partners because we share health system partners. And then I look forward. So we have a senior safety event coming up at the community center in June, and we're super excited about that. We have mental health first aid programming happening
Tomorrow.
I'm like, it's this week. And then strategic planning. We're embarking on, our current strategic plan ends in 2025, and we have an infrastructure grant that will fund that strategic planning. So we look forward, watch for invites.
Does it
To participate.
in June, or
When does strategic planning start?
when does the current one up?
Oh, the end of 2025. So December.
Okay.
Yeah.
Does the fiscal year in DPMC run July to June?
Calendar year.
Okay.
January to
All right.
December.
Very good.
Yep.
And I also have to point out the Chapter 140 review. Terry and I attended that. It was about 3 hours long. It was more or less a dialogue between representatives from the state and our city health department staff, and our staff did a terrific job explaining a number of issues to the state and the documentation that took place as well. I was very impressed with how well prepared that they were in terms
Yes.
of getting ready to hopefully become a level 3 health department if that is approved by the state with the information that you provided.
The people that came were very impressed as well, so.
So
Good job, staff team. and Sarah and Danielle, who are not here tonight.
Thank you. We have a really good health department, so thank
Yeah,
you.
we do.
Mm-hmm. You guys do a great job.
We sure do. Yep.
Have a good team.
Yeah, we do. Small but mighty team.
Mm-hmm.
Any future agenda items? I guess probably one thing would be if there's ways that you can keep us updated about any potential or realistic cuts that it may be occurring down from the federal government on down.
Yeah.
And just drop us an email or something like that so we know and what the impact would be on the health department as
Okay.
well, if there is any impact.
Or if there are any public events that you think it would be helpful for us to attend or you'd like us to know about, that would be great.
Okay, that sounds good. Thank you. I always appreciate your support. So yes, and next agenda, I will have a director's report agenda item.
Okay, you make sure it's on there.
Yes.
That was a software glitch, I think, wasn't it?
I hope so.
Human
Okay.
error software, I don't know.
Something like
We
that.
don't know where it went.
Okay. Any other questions? Ready to adjourn? Can I have a motion for adjournment?
So moved?
Yes, second?
Second.
Any discussion? All in favor, say aye.
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 Any opposed? We are now adjourned. Thank you very much.
you.